Well, welcome to our new COVID-19 interview series called Rising to Meet the Moment, where we engage with stakeholders on different issues and aspects on behavioral health and how they are responding to COVID-19 and rising to meet this moment. I'm Jessica Cruz. I'm the CEO of NAMI California and the co-chair of the Behavioral Health Action Coalition, where our mission is to engage California leadership in prioritizing behavioral health issues and reducing stigma. And joining us today, we have Dr. Nadine Burke Harris, who is an award-winning physician, researcher, advocate, and the first and current Surgeon General of California. Welcome.
Thank you so much for having me. It's such a pleasure to be chatting with you today.
Well, thank you so much for taking the time. We'll just kind of jump right in. Let's talk about a little bit of the importance of addressing physical and psychological well-being of all individuals, particularly in this new era.
Yeah, well, I think for myself, my background is as you mentioned, a researcher and a physician looking at how stress impacts our health, right? And I think right now we're all feeling a lot of stress, or at least most of us are. And so I think that's really coming to the forefront. And this question of how do we support our physical, mental, and emotional well-being during this time, I think is a really, really important question. I will tell you that in my mind, right, that they're not separate, that mental well-being is physical well-being, physical well-being is mental well-being. The body doesn't distinguish. We don't stop at the neck. And recognition that now is a time of greater vulnerability for a lot of people.
And bringing back into that mind and body together, can you talk a little bit about maybe some physical symptoms that people might be experiencing that actually might be related to some behavioral health challenges? And just so that we're all aware, especially during this time where some of us aren't necessarily focused on our mental wellness, or we're used to being focused on our mental wellness. Mm-hmm. And now we're in a time where all of a sudden it's kind of bubbling up. So can you talk a little bit about how the physical kind of relates to the mental and what that might look like?
Yeah, so one of the things that I like to say to folks is that if you're feeling more stressed right now, if you're feeling more on edge, some people may be noticing changes in their sleep pattern. Some people may be noticing changes in their appetite and their dietary habits. Those potato chips and the chocolate chip cookies may be harder to resist right now. What I say is that it's not just in your head. Actually, what we are seeing is that the increased stress that many of us are feeling because we're in a pandemic. Right? And then on top of that, so many folks are experiencing economic distress as well. And then, I think for everyone, there's disruption in schedules. Kids are at home. Like there's lots of changes, lots of adjustments that we are all going through right now. And that one of the ways, so some of the things that can happen are things that we think about are predictable, like increased risk of anxiety and some of those emotional responses, but also recognition that our bodies are actually making more stress hormones right now because there's something stressful going on, and that shows up in how we're feeling, but it also shows up in our health and how our bodies are reacting. And so now's I would say a really important time to be tuning in to better understand how stress shows up for us, right? And whether it's, impacting your mood, or whether you're noticing that you're just, you can't lay off the all that fresh baked bread that everyone's been baking, right? Just number one, having awareness of it, right, is I think one of the most important first steps.
Yeah, that's great. And For those people who are maybe already experiencing a behavioral health condition, a diagnosed condition, their family members, during this time, when everybody's thinking about their wellness and the increased stress and anxiety, for those people who are already dealing with behavioral health challenges, what are some things that they could do to help kind of relieve the increased stress and even triggers? For some people who might be in recovery right now, they could have some triggers.
Yeah. So one of the pieces that I think is really important about the impact of stress on health, mental health and behavioral health, is that when we look at those increased stress hormones, right? One of the parts of the brain that they impact is our pleasure center. It's our reward center. And the reward center is the part of the brain that's implicated in substance dependence, right? And so what we see is that in times of increased stress, there's increased vulnerability to some of these behavioral challenges, and it's in part because of the impact of stress hormones on that pleasure and reward center of the brain, right? And so what that means, this happens, I think what we see is that this happens on a broad spectrum. I think that it's for those who have a history of a behavioral health condition, they're at greatest risk. But I will tell you, the number of people that I know who are like, all of a sudden, I noticed during COVID, I don't stop at one glass of wine with dinner anymore, right? Now it's like every night is a 2-glass night, right? How did that happen? Right? So I think that it's important for something that's important for all of us to be looking at, but especially for individuals who have had a history of a mental health or a behavioral health concern. And also, the other thing that's really important is individuals who have a history of childhood adversity, right? Or a history of adversity or trauma. Again, they have increased vulnerability, and it could be because of an overactivity of the stress response, or it could be because of an increased vulnerability or a sensitization to the effects of stress on parts of the brain and body. And so understanding those pieces, we recognize that some of the kind of stress busting techniques, which are techniques that are evidence-based interventions that we put out the Surgeon General's playbook on stress relief during COVID. And some of these, so the techniques that are in the playbook are really evidence-based techniques for improving health and behavioral health and mental health outcomes when you're experiencing increased stress, right?
So
things
let's
like
talk
regular
about some
exercise.
of those. Like, what are some of those resilient tools that people can use from the stress book?
Yeah, so regular exercise is a really important one. So we know that exercise not only helps our bodies to, metabolize or burn up those stress hormones, but it also helps to release, endorphins and other healthy hormones that help to protect our brain from the effects of stress, right? So folks might notice that when they do a good workout, they actually feel a little bit better, and there are real neurochemical reasons for that. Another important technique is mindfulness, like meditation. There's never been a better time to download a mindfulness app on your phone, or, go online and find that mindfulness practice. And that's something that has been documented in research to help to reduce stress hormones, and can also reduce symptoms of depression and PTSD and other health conditions. It also actually has been shown in some research to offer some cardiovascular protection as well. So again, the brain and body not separate. So those are a couple. One of the other things I think is really important is that while a lot of our routines are kind of disrupted right now, one of the important things is, while there's a lot that we can't control, one of the things that we can control is what time we go to bed and what time we wake up in the morning. And actually going to bed at the same time each night and waking up at the same time each morning, it's actually not just like a good habit. It turns out that the brain entrains to those sleep schedules. And when you get off those sleep schedule, your body can release more stress hormones. Like, you ever notice that when you like stay up really late at night, like you miss a nice night of sleep or whatever, you kind of feel wrecked, right?
Mhm.
And it's not just because of missing sleep. It's also because when you miss sleep, it just spikes all of your stress hormones, right? And so these are things: going to bed, waking up, same time each day, to help to entrain the brain and have these predictable schedules so that your stress response system can kind of reset or, recalibrate while you're sleeping. So those are just a few of the tips. There are more that are included in the Surgeon General's playbook, but those are just a few.
And it's fascinating, all of the whole sleep pattern thing. That is so fascinating to me, because we were talking earlier about just our schedules and how different they are, and kids and working. And so those are really good tips for us to make sure that we're staying almost level through this whole pandemic. But let's maybe shift a little bit and talk about those most vulnerable populations. How might we be sure to help the more vulnerable populations within California?
Yeah, well, there's a lot that we can do to help our more vulnerable populations. I think that number one is we've been working really, really hard within Health and Human Services to ensure that our mental health safety net is there, right? To support the most vulnerable. That feels like a really top priority for the administration, is just to ensure that we have that safety net so that folks have access to those services. Because what we're hearing from many of our mental health practitioners is that it's very variable. While there's certainly increased need because in certain situations fewer people may be walking in the door, right? That can pose a challenge to our mental health providers, particularly our mental health providers that are serving our most vulnerable Californians. And so that has been a really big priority for our teams.
That's great. Can you talk a little bit about, you talked about the administration and kind of the behind the scenes. Can you give us a little bit more what kind of interaction has happened with the governor? What prompted the development of this playbook, and kind of what's on the horizon and what's next?
Yeah, so we were I have to say, in the Newsom administration, you have to be careful about what you say, because one of the things, my background being a stress physiology researcher, and I made the comment like, wow, I'm really concerned. I think that the likelihood is, given all these factors, the stress from the virus, the economic distress, all the stuff, that we're going to see, increased risk of stress-related health outcomes, including mental, behavioral, and medical. And of course, if you say that, anywhere near our governor, what you will be asked for is a plan, and very quickly ask for, hey, what can we do about it? And that's what we've all been working really hard within Health and Human Services across the administration, is really, how do we provide solutions that folks can take and put to use when they need them. So that was the birth of the playbook, was really just be raising a concern in a meeting and putting that together. But I have to say, the information that's included in the playbook comes from years of research from leading researchers across the country and across the world, and looking at what are some of the best practices and interventions to help regulate the stress response and improve outcomes for folks who are undergoing a stressful time.
And I really appreciate the consideration of kind of that prevention and early intervention piece, like getting ahead of it. But the way that we see it, it's like a tsunami, right? We're in this first wave. The second and third of the trauma that's to come is going to have a lasting impact. Can you talk a little bit about the work that you've done with ACEs and kind of what we should be watching for on that second and third wave when it comes to what this stress is going to do not only for individuals, but for our children?
Yeah, so let me talk first about ACEs being adverse childhood experiences. And, that term comes from the major research study that was done by CDC and Kaiser Permanente, which showed that they looked at 10 specific categories of childhood adversity, and those include physical, emotional, and sexual abuse, physical and emotional neglect, or growing up in a household where a parent was mentally ill, substance dependent, incarcerated, where there was parental separation or divorce, or domestic violence. And what they found was two things. Number one, these factors were incredibly common. So 2/3 of folks in the original research study had at least one adverse childhood experience. 1 in 8 folks had 4 or more. Here in California, 17.6% of Californians have experienced 4 or more adverse childhood experiences. So number one, really common. But number two, there was what they called a dose-response relationship between these ACEs. And not only the things I think that our mental and behavioral health colleagues have been telling us about for some time, right? Increased risk of, depression and suicidality, increased risk of anxiety, increased risk of substance dependence, so all of these challenges, but also things like increased risk of heart disease, cancer, stroke, Alzheimer's, right? Kidney disease, chronic lung disease. And what that did was really, it helped us recognize that the number of people who have a stake in addressing early adversity as a risk factor for lifelong health is really much broader than we had previously anticipated. And one of the pieces that we recognize is that we now understand more about the science of how that happens, is that when you have high doses of early adversity, right, it activates that stress response. You get all of those stress hormones, and that if that happens too often, that the stress response can become kind of chronically overactive and lead to actually changes in the structure and function of the developing brain, right? Because kids' brains are just developing. So that's why the childhood is a particular time of vulnerability, right? But not just the developing brain, the developing immune system, hormonal systems, and even the way our DNA is read and transcribed. And so these are some of the things that lead to increased risk of health problems. Here in California, we have launched a first in the nation effort to do the thing that the research tells us is just about the most effective intervention that we can do, which is early detection. So early detection and early intervention improves outcomes. And so we've launched this initiative called ACEs Aware to do screening, and not just of kids, right? But also of adults, because we recognize that if you're an adult and you're struggling with depression, right? Like understanding that you have a history of ACEs and that may be connected to your management, right, is really important. Similarly, if you're an adult and you have diabetes, right? If you're that may also, like your risk of diabetes is impacted by the ACEs that you've experienced. And so being able to do this early detection and early intervention so that we can incorporate this as part of our regular practice and implement trauma-informed care across the state of California. That's a thing that I'm really excited by, is this initiative. And we recognize that COVID-19 has only made the need for trauma-informed care and for ACE screening, frankly, more acute. Because ACEs are only going up right now, right? If we're just looking at our rates of intimate partner violence, right? Going straight up. If we're looking at, mental health and behavioral health outcomes, we see, increased, people having increased challenges, right? And we think about child maltreatment, right? Sadly, across the state of California, our rates of reports of child maltreatment have dropped by 40 to 50% since the shelter in place. And we don't think that it's actually going down. We think that it's still happening, and perhaps, likely even at a higher rate, but that it's going undetected and unreported. So these are some of the pieces that I think it's really important, just as we're doing disease modeling to figure out, how many people do we anticipate are going to get the virus, and how many hospital beds and how many ventilators we need. I feel like it's equally important for us to say, oh my goodness, recognizing COVID-19 as this major stressor for everyone, and for some people it really does reach the point of trauma, right? Then what does that mean about our projections of our mental and behavioral health needs, right? And what does it mean that we have to be ensuring that we have in place so that we don't have negative, we don't have morbidity and mortality, right? As a result. Yeah, I know, it's a lot.
Well, I love how you said that it's just as important to be looking at the outcomes of the physical piece of COVID and what this behavioral health piece is going to be, because I think it's going to, if we're not prepared, it's going to overwhelm us.
Mm-hmm.
Thank you so much for taking the time. I could talk to you. I'm so fascinated by all of this stuff, so I could talk to you for hours, but I know we have a very limited amount of time. So thank you so much for taking the time and joining us for our Rising to Meet the Moment. It's a production of Behavioral Health Action, a coalition of more than 50 organizations united to raise awareness and reduce stigma around behavioral health. So thank you so much for joining and becoming one of our behavioral health champions.
And I will say to all of you, thank you so much for the incredible work that you all are doing every day. Behavioral health is so critically important and is not separate from our overall health. And I'm just grateful to be a partner for you and a champion for this work in my role as Surgeon General.